Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. Our patient is here today. He's a returning patient to the operating room. We did his surgery 2 weeks ago or so, and we did a lot. We were doing 5 discs, 10 facet joints, 2 SI joints, and I think, did we do his piriformis? No. All right, so we did all that, but we ran out of time and couldn't get to the SI joints. And we also tried but could not gain access to L1-L2 from the left side. So I told him, let me try from the right side. I told him it's a 50-50 chance we'll be able to get to L1-L2 disc from the right side. His disc is extremely collapsed, twisted, slanted, tilted, and the facet is enlarged and the spine is rotated. So it's got massive anatomical issues. We knew that going in. There's always a chance we can't fix all the things we want to fix because of the patient's anatomy. Patients understand that ahead of time. We discuss it with them. He understands I may not be able to get everything done today as well, but we're going to give it a try. Okay. Let's see where we are. If you have questions, feel free to ask me. I'll do my best to answer them. Shot? All right. Are you kidding me? Shot? All right, there it is. Okay, so we're going to be counting. If you have questions, feel free to ask me. 5, 4, 3, 2, 1. We're doing 1, 2. So the incision hopefully will be somewhere around here. I'm going to numb this whole area up because the way his spine is so twisted, and I'll show it to you guys in a moment. You'll see it on the AP view. It's very, very difficult to predict where the entry point should be. His spine is twisted away from this side, I believe, towards the left side. So let's see what we've got. Shot? All right. Once again, 5, 4, 3, 2, 1. That looks pretty good. Jordan, go ahead and center L1-L2 up for us. So because we ran out of time the first surgery, we went at about 2.5 hours. Don't want the patient to have any kind of issues. So the kind of problems they can do is get tired. They can, have labored breathing, difficulty moving air because they're so tired. We didn't want that. All right, let's see. There's 1-2 at the top. Wouldn't you agree? So 1-2 has a tiny little like black thing at the back of the disc. Let's move up to 1-2. Or whatever. Are you happy where it is? I mean, can you go further north and center it a little bit more and get the WAG and orbit done proper? Yeah, that's good. I like that. Now we're off on orbit by about 1 degree. So let's see if we can fix the orbit. I'm not sure if that made it better. Do you think maybe it did? I think, really? I was going to say that looks better to me, but maybe you're right. Let's stick with that. I need to drop the table a little bit, if you can drop the table. Shot? That's it? All right, that's great. So we're aiming right there. That should be good. Let's see. Shot? If you have questions, feel free to ask them. Otherwise, we're going to share with you some information about back pain. Back pain has many causes. There's about 30 of them. And we're going to show you our little video on the 30 most common causes of chronic back pain. Shot? And before we do that, let me just show you the AP view of this spine so you can see what I'm talking about, how twisted it is. Shot? All right, let's do our AP view. We're going to take a quick look at his spine so you can understand the curvature issue here, the scoliosis, which does not need to be corrected in my opinion. There it is. Look at that spine, how twisted it is. Okay, can you see that, Henry?
Yes, we can.
Yeah, amazing. All right, and then and the needle position looks perfect where it is, entering the foramen, touching the facet. I'm very happy with that. Hopefully we'll get it this time. We couldn't do it last time 2 weeks ago because we were on the other side and it was totally collapsed. Let's show the audience the 30 different causes of back pain. Sean? I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk. Thanks for joining us. All right, so we're trying to get into the L1-2 from the right side disc transforaminal, but it's just not going in. Once again, every time I reposition my needle, it kept getting pushed either up or down by the collapse of the disc, scar tissue, osteophyte, combination of abnormal stuff, and I'm just not getting into the disc space. Normally we would have a loss of resistance here, but it's just not going. So we're not able to, unfortunately not able to get into L1-2. I don't want to hurt the patient, so it's important to know when to stop. And we tried it on the other side, I was unsuccessful. I tried it on this side, not successful. L1-2 is just too collapsed. It looks like there's a gap there, but I can't get into it. I've tried repositioning the needle multiple times, it just keeps going to the same place. So we're going to move on to the SI joint. We don't need to restart the stream.
No worries.
We're just going to keep going.
Copy.
All right. So the patient has sacroiliac joint pain, and we were supposed to do a rhizotomy last time. We're going to do it this time. Shot. You can see he's got some stents as well. All right, so a little bit too medial. I want to go right about here. Shot. Not there yet. Hold on. Maybe actually a good spot. Let's go ahead and numb that up. So I'm using the localizer to mark my incision where we're going to go in. You can see I've chosen a spot that's about 2 centimeters medial to the medial protrusion of the iliac bone. The reason is I need you to bring the fluoro higher, please. If you have questions, feel free to ask, but we moved off of the Deuk laser disc repair for the L1-2 since we can't access the disc shot. And now we're moving towards the SI joint denervation. It's called a rhizotomy, very common procedure. Done. Shot.
We have a question.
I'll take the question.
Coming from Ping on Facebook. Oh, and Ping just asked another question.
All right.
First question being, what is the main cause of scoliosis?
The main cause of scoliosis, there's 2 types. One is adult, the other is juvenile. Juvenile is rare, thank God. It affects children, and nobody really has a great idea of what causes it. Shot. But for adults, the number 1 cause is degenerative. Degenerative scoliosis is where the disc basically is injured. It collapses. All right. And as the disc is collapsing, it doesn't collapse symmetrically, it collapses asymmetrically. Shot.
Next question.
There we go. Shot. And then the other thing that happens is the facet joints. Oh, by the way, lots of scar tissue here. A lot more than I expected. Shot. When the disc, the other thing that collapses is the facet joint. Okay? Facet joints that's perfect position right there. You see where that tip is? That's exactly where the pain nerve runs. Right in that little channel, that little groove. That's the most common location for the L5 dorsal ramus, which is the first point of innervation to the SI joint. Now, I treated this area last time. I'm just treating it again just to be 100% sure we don't miss anything. I don't want to have him in any pain when he's done. I'm going to move lateral here. So to answer your question, the scoliosis, number 1 cause of scoliosis in the world is degenerative spine conditions, such as degenerative disc disease, degenerative facet disease. So what happens is you get an injury to the disc. You also get an injury to the facet at the same time. The injured disc and facet start to collapse over time. And as they collapse, the spine settles, and the settling of the spine basically is not symmetric. It's kind of like a house settling on its foundation. It's not going to just settle down nice and even. It usually one side goes down deeper than the other side, and then the house starts to twist. And that's what happens with the spine. So it's a settling of your spine from degenerative injuries like disc and facet that just don't settle down properly. They settle asymmetrically. All right. Sean?
We have another question coming from Ping on Facebook,
Yes, Ping.
asking how long does it normally take with normal wear and tear for the disc to collapse? Is there a chance with a herniated disc and after the DLDR that the disc will not collapse?
Yes, Ping. That's the whole purpose of the DLDR, is to let the disc heal naturally. So once your disc is healed, it's not going to collapse, right? I think I need another tip. So if the annulus is debrided, the idea is then that your body will seal it off and it'll close. So if you think about like the spine is like a car with 4 tires, right, filled with air. If you puncture the rear tire on the right really bad and it loses air very fast, then that's going to sink down quickly to the ground. That side of the car will sink. Shot. Now, if you also puncture another tire, but not as big, then it'll sink slower. And if the other tire, where it's a smaller puncture, it's letting the air out slower, it's going to sink slower. So what's going to happen is your car is going to sink on that side slower. So you get this rotation of your spine as it's sinking from the facets and the disc. If you repair the disc, then it won't sink. And I think that's it. I think we did it as much as we can on this right side. We're going to go to the left. So the idea is you repair the disc with the Deuk laser disc repair. The annulus seals. The disc stops collapsing because the inflammation stops. So your disc is not being destroyed anymore. So yes, the purpose of the Deuk laser disc repair is also to prevent further collapse of the disc. All right, so let's go to the other side. Shot? We got about 8 minutes left. That looks pretty good to me. Go ahead. Any other questions?
No current questions. So in the meantime, why don't we show the audience how it is that we how we do this procedure? Yeah.
You sure?
Yes.
All right.
Of course.
All right, let's do that.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. And we are now working on treating the sacroiliac joint on the left side. So we are destroying pain nerves that are in the back of the tailbone. We stay away from the front. You don't want to go to the front. So you're always checking your x-ray to make sure that you're staying in the back. And the joint is actually quite deep in the top half. So you have to go anterior. And that's what I'm doing. Shot. I'm right up against the sacrum here. All right. All right, well, let's hope that does it for him. You never can see the nerves you're destroying. All you can do is burn based on the x-ray where the bone is, and that's what I did. So you want to burn where the nerves go and innervate the joint. You want to basically amputate those pain nerves. That's what a rhizotomy is. So it went well for him. Just couldn't get the L1-2 again, unfortunately. You can see how small the incisions are. They're 4 millimeters each. Okay, our next patient's going to be an interesting one. He is a thoracic disc herniation. And we're going to be doing a thoracic Deuk laser disc repair. So come back in about 30 minutes and we'll be doing that one. Any other questions?
No current questions.
All right, thank you.